Could we envision a future where perioperative and procedural care is not just efficient but also predictive, personalized, and proactive? As we stand on the precipice of the 24th century, we are confronted with a landscape of healthcare that is rapidly transforming. Amidst the whirlwind of advancements, one area that holds immense potential for evolution is perioperative and procedural care. Currently, the field faces a myriad of challenges. From the complexities of managing diverse patient populations to the strain of coordinating multidisciplinary teams, the process can often seem like a high-stakes jigsaw puzzle. Add to this the ever-present pressure of ensuring patient safety, improving outcomes, and reducing costs, and it's clear that the demand for innovation is not just a desire, but a necessity. So, what does the future hold for perioperative and procedural care? Imagine a world where care is not reactive, but proactive. A world where clinicians can predict potential complications before they occur, personalize treatment plans to the unique needs of each patient, and take preemptive action to mitigate risks. This is not a distant dream, but a future that is within our grasp, thanks to the power of technology and data. In this age of digital transformation, technology has become an indispensable tool in healthcare. It has the potential to streamline processes, enhance patient care, and ultimately, save lives. Similarly, data holds the key to unlocking a treasure trove of insights that can drive decision-making and shape strategies. Together, technology and data are the twin engines propelling us towards a future where perioperative and procedural care is not just about treating illnesses, but about preventing them. A future where care is not just about curing, but about caring. And who is at the forefront of this revolution, you might ask? The answer is Surgical Directions. With their pioneering approach, they are not just witnessing this transformation, but actively shaping it. In this video, we'll explore how Surgical Directions is powering this future. So, what is Surgical Directions, and how is it revolutionizing perioperative care? Surgical Directions is more than just a name. It's a game changer in the realm of healthcare, a catalyst for innovation in perioperative and procedural care. At its core, Surgical Directions is a healthcare consulting firm. But it's not your typical consulting firm. It specializes in transforming surgical and procedural service lines, helping hospitals and health systems to enhance their efficiency, increase their revenue, and most importantly, improve patient outcomes. The mission of Surgical Directions is clear and inspiring. It aims to empower healthcare providers with the tools, strategies, and insights they need to deliver exceptional care. In an era where everything is data-driven, Surgical Directions leverages the power of data analytics and technology to make this mission a reality. So how does Surgical Directions do this? It's all about providing comprehensive solutions tailored to the unique needs of each healthcare provider. These solutions range from strategic planning and process improvement to leadership development and change management. But what sets Surgical Directions apart is its focus on data. It uses data analytics to identify areas of improvement, track progress, and measure outcomes. This data-driven approach allows healthcare providers to make informed decisions, optimize their resources, and ultimately enhance their patient care. But Surgical Directions doesn't stop at data analytics. It also harnesses the power of technology to improve perioperative care. It uses advanced software solutions to streamline workflows, manage surgical schedules, and facilitate communication among healthcare providers. These technological innovations not only increase efficiency, but also help to reduce errors, enhance patient safety, and improve overall care quality. So there you have it. Surgical Directions is not just a consulting firm, but a driver of change in the world of healthcare. It's a company that's using data and technology to revolutionize perioperative care, making it more efficient, safer, and more patient-centric. But how effective is Surgical Directions? Let's delve into a case study to find out. We turn our attention now to a medical facility that has experienced the transformative impact of Surgical Directions. Imagine a bustling hospital in the heart of a major city. Their surgical department is the beating heart of the institution, performing hundreds of surgeries a week. However, they found themselves grappling with inefficiencies that were impacting patient care and staff morale. Operating rooms were sometimes underutilized, while at other times there were backlogs. The hospital was also facing financial pressures due to costly surgical delays and cancellations. Enter Surgical Directions. Their team of experts rolled up their sleeves and got to work, first by conducting a thorough assessment of the hospital's surgical department. They examined every facet of the operation, from preoperative procedures to postoperative care, and identified bottlenecks and inefficiencies. Once the assessment was complete, they put in place a comprehensive plan. This plan was not a one-size-fits-all solution, but a tailored strategy designed to address the specific challenges of the hospital. The plan included process improvements, staff training, and technology enhancements. It also emphasized the importance of communication, teamwork, and leadership in achieving the desired outcomes. The implementation of Surgical Directions Plan was not an overnight transformation, but a gradual process that required commitment from all stakeholders. However, the results were well worth the effort. Within the first year, the hospital saw a significant decrease in surgical delays and cancellations. Operating room utilization improved, allowing for more surgeries to be performed. Patient satisfaction scores increased, and staff morale improved. The hospital also experienced financial benefits, with cost savings from reduced delays and improved efficiency. Fast forward to today, and the hospital is a shining example of what can be achieved when you combine cutting-edge solutions with a dedicated, passionate team. The surgical department runs like a well-oiled machine, delivering high-quality patient care day in and day out. And while challenges still arise, they are addressed swiftly and effectively, thanks to the systems and processes put in place by Surgical Directions. It's important to remember that this is not an isolated success story. Across the country, and indeed around the world, healthcare facilities are experiencing similar transformations, thanks to the power of Surgical Directions. Whether it's a small rural clinic or a large urban hospital, the impact is the same: improved efficiency, enhanced patient care, and a healthier bottom line. So, what's the secret to Surgical Directions' success? How have they managed to transform surgical departments and improve patient outcomes? Well, it's a combination of factors, including their deep expertise in perioperative and procedural care, their innovative solutions, and their commitment to partnership and collaboration with their clients. This case study is just one example of the power of Surgical Directions, but what are the key factors behind its effectiveness? What are the key drivers behind the success of Surgical Directions in transforming perioperative care? That's a question many in the healthcare field are asking, and today, we're going to delve into the answers. Firstly, it's essential to understand that Surgical Directions operates on a data-driven approach. In this age of information, data is king, and Surgical Directions understands this better than most. By leveraging vast amounts of data, the organization is able to gain insights into patient care that were previously unattainable. These insights allow them to optimize their strategies, streamline their processes, and ultimately deliver a higher standard of care. This data-driven approach is more than just a buzzword. It's a philosophy that underpins everything Surgical Directions does. Secondly, Surgical Directions is a hotbed of innovation. They don't just accept the status quo, they challenge it. They're constantly exploring new technologies, testing out new methodologies, and pushing the boundaries of what's possible in perioperative care. This commitment to innovation is what allows Surgical Directions to stay at the forefront of the field, leading the way in perioperative and procedural care. However, innovation and data alone are not enough. The third key factor behind the success of Surgical Directions is its focus on personalized care. We all know that no two patients are the same, and Surgical Directions fully embraces this reality. They understand that each patient has unique needs, unique circumstances, and a unique journey through the healthcare system. As such, they strive to tailor their care to each individual, ensuring that every patient receives the best possible treatment for their specific situation. This personalized approach is not only more effective, it's also more humane, treating patients as individuals rather than just numbers. But let's not forget about the team behind Surgical Directions. A company is only as good as its people, and Surgical Directions is blessed with a team of dedicated, skilled, and passionate professionals. These are individuals who truly care about their work, who are committed to making a difference in the lives of their patients. They bring their expertise, their creativity, and their compassion to the table every day, and it's this combination that truly sets Surgical Directions apart. Lastly, Surgical Directions is built on a foundation of collaboration. They understand that healthcare is a team sport, and they work closely with all stakeholders, from surgeons and anesthesiologists to nurses and administrators, to ensure a cohesive, integrated approach to care. This spirit of collaboration is what allows Surgical Directions to break down silos, foster communication, and create a culture of continuous improvement. Surgical Directions is not just shaping the future of perioperative care, it's here, it's now, and it's making a difference. This is not just a catchy phrase, it's the reality of what Surgical Directions is achieving every day. With its data-driven approach, innovative solutions, personalized care, dedicated team, and collaborative ethos, Surgical Directions is not just powering the future of perioperative and procedural care, it's doing so with a level of excellence that is truly inspiring. What are the critical points to remember about Surgical Directions and the future of perioperative care? As we wrap up our discussion, let's revisit the crucial takeaways that underline the transformative role of Surgical Directions in perioperative and procedural care. Firstly, Surgical Directions is not just a concept, it's a reality that's already making waves in the healthcare landscape. It's a comprehensive approach that's optimizing operations, enhancing patient outcomes, and driving cost efficiency in healthcare institutions. It's not just about surgery. It's about a holistic, patient-centric approach that takes into account the entire surgical journey. Secondly, we've seen through our case study how Surgical Directions is making real-world impact. It's not a theoretical model. It's a practical solution that's being implemented in healthcare facilities to improve the quality of care, reduce operational costs, and increase patient satisfaction. The proof, as they say, is in the pudding. Thirdly, the power of Surgical Directions is not just in its methodology, but also in its adaptability. It's a dynamic model that's constantly evolving to meet the changing needs of the healthcare industry. It's not a one-size-fits-all solution. It's a flexible approach that can be tailored to the unique needs of each healthcare institution. Fourthly, Surgical Directions is not a standalone entity. It's part of a bigger picture. It's a key player in the larger healthcare ecosystem, working in conjunction with other stakeholders to drive innovation and improvement in perioperative and procedural care. Lastly, the future of perioperative care is not a distant dream. It's a reality that's unfolding before our eyes. And at the heart of this transformation, Surgical Directions stands as a beacon of innovation, leading the charge towards a more efficient, patient-centric, and cost-effective healthcare model. As we move forward, Surgical Directions stands at the forefront, powering the future of perioperative and procedural care. It's time to embrace this future. So, how can you be a part of this revolution in perioperative care? Imagine the possibilities. Picture a world where perioperative and procedural care are optimized, streamlined, and patient-focused. That's the world Surgical Directions is creating. Now, consider your own healthcare facility. What could it achieve with Surgical Directions? We invite you to explore the potential for transformation. Dive deep into the world of Surgical Directions. Unearth the potential it holds for your facility. Understand how it can revolutionize the way you deliver care. This isn't about merely adapting to change. It's about driving it. It's about being at the forefront of a healthcare revolution, leveraging advancements to deliver superior care. Remember, the true power of innovation lies not just in its creation, but in its application. It's time to move beyond the conventional and embrace the extraordinary. The future of perioperative and procedural care is here. Don't just watch it unfold, be a part of it.